record this. Okay, so today's session is about medical ethics, which are important part of FOP, Foundation of Practice exam, as well as AKP exam. So we start with some basics. Let me share the screen. Please someone acknowledge me. Can you see the screen and can you listen me?
Yes, I can see the screen, but it's all white.
All right, okay. Now, actually it is a whiteboard. I want to write something. That's the reason it's all white.
Okay.
Yes. Okay, guys. So starting with the ethics. What is the ethics? It is a system of moral principles that applies values and judgments to the practice of medicine. Guys, it is a very beautiful topic because it gives you the code of practice. While you work in the UK, this is the UK exam, so you know what is the code of practice in the UK. So with this topic gives you insight into the behavior code, or you can say the professional, how doctors should professionally deal with different day-to-day conditions which came across in the clinics or in the hospitals. So they give you some principles that applies values and judgments to the practice of medicine. There are four pillars. There are four pillars of ethics, which are mentioned in the Science of Pediatric books. And these four pillars are the beneficence, non-maleficence, autonomy, and justice, as we all know. Should I write these four? A for autonomy, B for beneficence, all right, justice, and non-maleficence. All right. What is the autonomy? Autonomy means ability to self-govern. Ability to self-govern, like it, they are referring towards the consent of the patient. It is unethical to treat a patient against his will. This is called the autonomy. Beneficence means giving benefit, as the name indicates, giving benefit and not acting against the will. All right. What is the justice? Justice means that you provide your treatment according to the clinical needs. Fair treatment, fair and consistent treatment according to the clinical needs. This is the justice. And non-maleficence means do not harm. So these are the four pillars. This was just the intro of the ethics. Now by the end of this lecture, there are some topics then you become familiar with. One is the most important, who can consent?
Who can consent?
Who can consent?
Who can consent?
There is a doubling of voice. Please check your mics. Please check your mics. Okay, thank you. Who can consent? This is a very important part of this ethics portion. What is the parental responsibility? What is who can consent in the foster care? Who can consent in the life-saving procedures? what is confidentiality, and one thing, that is the blood transfusion in the Jehovah's Witness. I will tell you about the Jehovah's Witness. Jehovah's Witness and circumcision, these are some religious matters that you need to learn how you will act and respond in such conditions as a doctor while you're working in the UK. Okay, what is your role when a patient escape or run away from the hospital? What kind of patient? Psychiatric patient. He escape or run away from the hospital. These kind of question came many times in FOP exam. I will be telling you that. Another thing I will be sharing in this lecture is the criteria if the mother is HIV positive. Then ethically, what's your role? What's your role when someone in UK asks you for contraception and she is a minor, or if she is even not a minor but her family don't know about her sexual relations, and she asks you to prescribe contraceptive pills, then what you should do? I will be telling you about that. And what are the different conditions you call police while you're at UK? All right, so at the end of my lecture, you will know all these conditions I mentioned. And yes, the most important thing, do not resuscitate order, DNR, where it is applied and where it is not applied. I will be telling you that. So now I'm coming towards recall and I'm explaining each and everything. Okay, let me share the recalls. Can you see the screen? Can you see the screen? Recalls are visible?
No, ma'am.
No, not visible?
No, no, it's the whiteboard.
It's whiteboard. Okay, first let me remove the
So
whiteboard.
it is written like ethics, palliative,
Okay,
autonomy.
Okay, let me remove this. I have removed the whiteboard. Now I'm sharing my screen. Okay. Acknowledge me when it becomes visible. Hopefully it's visible now.
Yes,
Now
ma'am.
it's visible.
Yes,
Oh,
yes,
okay,
yes.
that's great. That's great. Okay, so this is your ethics portion. I will be covering each and every question in detail. See the question number 1. Okay, let me mark it, highlight it or mark it. Okay, so this is a 10-year-old girl who came with the mother partner. Mother partner means stepfather. Stepfather, and she came with acute abdominal pain, with a diagnosis of acute appendicitis, and she needs operation within the 4 hours. Mother is outside the city. Mother is outside the city and aware about the condition. So whom to take the consent? Options are mother partner, daughter, surgeon, doctor in charge, and mother by whom. Correct option is highlighted here, but first you need to have some background knowledge for solving this question. Okay, I'm giving you the background knowledge. First of all, who can consent in UK? There is a terminology known as Gillick competent or Fraser competent. Gillick, Gillick competent. If you wish me to write here, I can write over here Gillick competent. You can write your notes with me. What is the Gillick competent? Gillick competent in UK is
A person who is mature.
yes, person who is this much smart and this much mature enough that he or she can understands about the treatment, understand about the disease and its management. So in UK, usually for consent, 16 year and above is legally competent. person. 16 year and above is considered legally competent person in UK. 16 years, in some books, 16 years written for the Scotland and 18 years written for the UK. But keeping in mind, most questions you solve by 16 year, you take the cutoff point. It is 18 years and above legally competent in USA, and 16 years and above usually taken for the Europe. One condition is that. Another is that it can be any age below 16 year, but if the person is legally competent. 16 year is the legally competent person who can consent for himself, but it can be below 16 year if he or she is Fraser or Gillick competent. And Fraser or Gillick competent is such a child who is very smart and who is intelligent enough, so he understands about the disease, understands about the management, treatment, home remedy, and all this. So he sometimes 11-year-old we consider as he can consent for himself because he is Gillick competent. He is very smart. All right. So this is basically the concept. Another thing is the psychotic child. A child who is psychotic, he is not dependent on the competence. Like he cannot consent for himself. Either his parents or either legal advice is taken for the psychotic child. If the cases of anorexia nervosa, these are some exceptions. If the cases of anorexia nervosa, then anorexia nervosa, you always treat against the will of the that teenager child, because it is such a condition, they will always refuse you. They will always refuse you. So this is the one exception. And another exception where consent is not needed is a self-harm condition. All right. Okay. Another thing, before 2003 in UK law, there was a rule that mothers were considered as they have the right to consent for every child, the biological mother who given birth. But after 2003 they have made changes in the law, and they said that whoever is mentioned, who is in name is mentioned in the birth certificate, whoever has taken the parental responsibility, either can be the dad or mom, among these two can consent for the baby. Biological mother and the biological father, they can consent for the child if, sorry, 1 minute, after 2003 they can, if their name is written in the birth certificate, as they taken the parental responsibility. So here the 10-year-old girl is coming with the stepfather, not the biological father, and we are not having the birth certificate where we can see where we can trace his original father, we can trace his biological father. The most appropriate answer is you can connect to the mother by phone. All right, but mother partner cannot consent for this girl. And surgeon doctor in charge also cannot, because if mother is available, if you can connect to the mother by phone, then there is no need that surgeon doctor in charge can consent. Yes, he can consent in certain condition if they came with acute appendicitis that is ruptured, that is emergency, and mother cannot be connected by phone, then surgeon doctor in charge will consent. All right, so the correct answer is D, mother by phone. Understood? Should we move to the next question?
Yes. Yes,
Oh,
yes.
okay, question number 2 is, sorry, I lost the screen. Sorry, guys.
You
Ma'am,
Yes.
one question. How do we know that the girl who is under 16 years old is Gillick competent, whether it is mentioned in the question or not?
No, look, she is 10 years old, and it is not written
Yes,
in the
that
statement that she is smart enough that she understands, and she
okay.
is already
So they will
10. How can she
So
consent.
whenever they ask about the Gillick component, they always mention it in the question
They will
that
either
Yes, they
he or
will.
she is
they will
mature
either
enough.
mention that the child is smart enough that he can take decision for himself. Some
Okay.
statement is somehow given, and another clue is that
Okay.
you can say is it is a acute abdomen condition, is an emergency. She is in pain. She is in
Okay.
distress.
Hmm.
All right. So
And
here,
most of the time, I think they also write it. School performance is very good.
yes, they give some clue somehow. They give
Yes.
some clue.
Yes.
Okay.
Okay, the next question is, okay, what's the next question? 13-year-old girl, second one. This 13-year-old girl want to have human papilloma virus vaccine, but her mother refuses. The girl read about the vaccine and understand. Look, this is the statement. If they write this word that she or he understand, this gives you the clue that they are Gaelic competent. Though she is 13 years old, below 16, but they have given they have written this understand means competent. Okay, this is it. Like this age comes in the adolescent medicine, and they are usually the sexually active uh, individuals. All right, so they might need human papilloma virus vaccine. All right, and she read somewhere that the benefits of this vaccine, she can benefit from the vaccine, but her mother is refusing. So what will you do? Will you acknowledge the mother wishes? No, you won't acknowledge the mother wishes because she is Gaelic competent and she can consent for herself. All right. I think this is very clear.
Yes, yes.
Okay. She is freezer competent. The third question is, child live with the grandmother under protection program. Under protection program. With rupture, came with the rupture appendix and came with the grandmother. Now who can consent? Who can consent in this condition? The grandmother, social services, surgeon who do the operation, or child, a doctor of child protection program.
No, it's straightforward surgeon because
It's a ruptured appendix. It is a ruptured appendix. So the surgeon, it is, if the surgeon consent for him, it is in the best interest of the child health. All right. Though the child is in the under the child protection program, and whoever is under the child protection programs mean they have been abused previously by parents or something like that, we can involve the doctor of child protection program or the social services, but here the appendix is ruptured, so we go for surgeon. Clear? Oh. Yes, this question where mother found oral contraceptive pills in her 14-year-old daughter room. She asked you not to write OCP. What will you do? What will you do? UK laws, they have given rights to the child, to adolescents, which are in the best interest of the child. All right, I'm generally telling if you stop prescribing oral contraceptive pills to these teenagers, they will stop seeking the medical advice. And in this way, UK, they lose their system. Like adolescents, they cannot gain access to these doctors, right? So they have given some rights to adolescents. Doctors can prescribe. All right, and the reason I have told you, if they won't prescribe, they suspect that adolescent, they won't approach them. They won't approach the healthcare, which is very necessary for a healthy generation. All right. So mother says, won't prescribe. Don't prescribe my daughter. No, you won't. You prescribe the medication, and rather you tell the mother that you discuss, you encourage them to discuss the matter, okay? These types of questions come many times, and you will select this option that you advise the parents, or sometimes you advise the daughter to discuss the matter. If the daughter, then they discuss the matter with their parents, and if the parents, they discuss the matter with their daughters, but you will prescribe it, okay?
Ma'am, is this the case only with OCPs or with any kind of medicine?
No, this is a case with OCPs.
No, I'm asking if they ask about any other kind of medicine. So can we prescribe them at the wish of the 14-year-old girl or an adolescent?
Here the question is, yes, we can prescribe, of course. If they are GILIC competent, and if they are coming to your clinic, you are the GP in UK or you are the consultant in UK, and if they just show up, they approached you for any of the problem, they are GILIC competent, you will prescribe. And if their parents say won't prescribe them, you won't acknowledge the wishes of the parent, you either ask the reason, and you either encourage them to talk to their child, talk to their son or daughter. All right. This OCPs, it comes under the ethical this heading, right? Because they are quite those types of things. Like in UK, these adolescents, they are usually sexually active and they won't share things with their parents. All right. Question number 3. Father of a patient find a file of patient in the restaurant and gives to you, and you find that it's the handwriting of one of your colleagues. Yes, what are your colleagues' rights? This also comes in ethics. Whenever you find something, whenever you find a file or any belonging, what will you do? What will you do? What will be your approach? If missing some important files, the first step is you talk to the colleague. You talk to the colleague once. The second step is you talk to them again. If they did this mistake twice, you talk to them twice. And the third time, you will involve the senior. Like this is like a warning to them. This came in negligence, right? That they have left the file somewhere. Got my point?
Yes.
Got my point?
Yes.
So the first step is you talk to the colleague.
Excuse me.
Yes.
I have just joined the discussion. In the question number 2, you have read the answer A. Advise her to discuss with her daughter.
Yes.
She is only 14 years old. Should
Yes.
not we stop prescribing the medication, the oral because she is minor. Under 16, she is minor. Yeah, under 18, she is minor. So she is still under her mother, her parents. So we have to discuss this with their parents, and if they allow, then we can write, and if they don't allow, we should not prescribe the medicine to the minors. Here you answered that advise her to discuss with her daughter.
Yes.
Instead of mother to discuss with her daughter, I think we should stop prescribing the medicine if the mother asks us to do so.
No, we won't stop. We won't stop prescribing the medication. If it is below 13 years, then you suspect some sexual abuse. 13 years is written somewhere. If it is below 13 years, then you involve the social services and even the police. It can be a case of rape, or it can be a case of a sexual abuse, something like that. But it is above 13 years. It is the 14 years. So you have to prescribe the medication. You have, because this is not in the, like, if you don't prescribe the medication, then these adolescents, they won't seek the medical, they stop seeking the medical advice. Are you getting my point? keeping in mind the
Yeah,
13
okay,
year.
okay. It means because it was confusion that it is 16. So you told me that it is
No,
13.
16
So
is
if he is
the,
above 13,
yeah, 16 is the age of
13 is the
legally,
limit.
16 is the limit of legally competent. Legally, you consider competent to consent. Legally who can give the consent.
Okay.
And if it is below 13 years, then you will suspect her minor, and you suspect that this is a case of rape or this is a case of sexual abuse. In spite you prescribe the medication, but you involve the social services or police to look into the case. This is like that.
Okay. Okay. Thank you very much. Thank you. It's clear now.
Okay, thank you. Okay, is this question clear? You talked to the colleague for the first time that you left the file on the table in the restaurant. If he did the same mistake again, you talk again, yeah, that you left the file again, this is the negligence. But if third time he did the same mistake, then you involve the senior and warn him. This is reporting
Yes.
to the government or reporting to the GMC, informing the GMC is very aggressive steps. You won't do these aggressive steps in the first go. And you inform the consultant in the, this is the third step. This option will become correct if he did this mistake twice before and this is the third time, then you inform the consultant as a warning.
Okay.
Right? Okay.
Yes.
Okay, if the meeting ended, then join the same day. Okay. Okay, girl
Okay.
came to ER with her mother's partner. Mother's partner is the stepfather with pain and has to go to emergency appendectomy. The mother is away. This is the repetition. This is the repetition of the question. Mother by
Mm-hmm.
Okay, they say when to transfer a cystic fibrosis patient to adult services. Okay, look, in UK, there are adult specialist cystic fibrosis centers. These centers are found in Birmingham, in Cambridge, Leeds, Liverpool, East London, South London, Manchester, many centers. I have kept a picture with myself. I will show you about the cystic fibrosis center. What is the adult center? Adult center, they offer a lifelong, because it is a chronic condition, right? Cystic fibrosis is a chronic condition and it needs management like physiotherapy, like psychosocial care, home care, and many things like that. It is a multiple approach services like. So they are asking you that when you shift a baby or a child to adult services. So here the options are when he is aware of the dose and how to take the medicine, when he is aware about his disease, when he is aware to take decisions, or when he understands his role and decision making. This is the best option, that when he understands his why his roles and decision making, because it has multiple approach, like for physiotherapy I have mentioned, psychosocial, home care, all these need his decision making power. So when you feel that the patient is now mature enough that he understand his role and the decision making, you transfer him to the adult services, right? Wait, I have a picture. I show you. Is the screen visible?
Yes, it is.
Okay. See, this is the adult cystic fibrosis services. An adult cystic fibrosis service is a comprehensive package of specialist care for adults who have cystic fibrosis. The service has to be high quality and it must be effective, deliver a positive patient experience, and to be safe. Service providers are hospitals and NHS trust that runs the hospital. A CF service must continue to provide support for adults throughout their lives.
Dr.
It is
Rabia,
a
from where are you reading?
screen. Screen is visible, right?
No, it's not.
It's not visible.
Yes,
How
it's
come?
not.
Okay.
Does anybody else has screen showing? I think only I'm the person here.
A yellow picture. Yellow picture is showing.
We can see only question number 2 in October 20.
Yes, only October 2019 is showing.
Okay. I will share this in the group. I will share this picture in the group. Right? The point I want to show you is that in UK there are many adult cystic fibrosis centers. So when you refer a child to this center, when you think that the child now understand his role and he has a decision making power, so then you refer him. This is just the point I want to make clear.
Okay.
I will share this picture in that group. Okay, you
Yes,
can
sure.
check later on. Screen visible?
Yes, the screen is visible. 2019 is showing. October 2019.
Actually, I have lost the screen. Okay, yes. Next question. We try to cover all this folder today. Ethics 1. 14-year-old girl. This 14-year-old girl has a 15-year-old boyfriend and they had the unprotected sex once and then came to ask for emergency contraception. She understands the benefits and uses of contraception, means the Gillick competent. She doesn't want her parents to know. What will you do? She is Gillick competent.
We will
Either
prescribe.
you prescribe the medication, and what about the confidentiality? You will keep the confidentiality.
Yes.
Okay, you keep the confidentiality. All right. Next question is a 12-year-old boy. 12-year-old boy follows up for Crohn's disease and told nurse that he had new anal ulcers and don't want his parents to know. This is again question of confidentiality. So I'm telling you something about the confidentiality. You in UK, you have to keep the confidentiality of the patient. And in what conditions you break the confidentiality? Anyone? Tell me those conditions where you can break the confidentiality.
If it is
When
sexually
the
transmitted.
First of
and
all, what is
where
confidentiality? Let me clear this. Confidentiality means that you never share the information about the patient to anyone else. This is the confidentiality. In UK, even in all countries, keeping the confidentiality of patient is important, but there are some conditions where you have to break the confidentiality and you have to inform others.
when the difference between the age of the two sex partner is more than 4 years, and if the child age is less than 13 or 12 years, of the male patient, like the male child in between the two sex partner is higher than the female partner. So we can break the confidentiality and we have to inform them.
Actually, Shabana, is it you?
Yes, it's me.
Actually, it is like that. When the girl is a minor and the boy is a major, then you
Yes.
suspect that this must be some sexual abuse or it is against the will of the girl. You suspect that. And when you suspect